Welcome to the Greater Winterhaven Chamber of Commerce Ask the Doctor series. This new series for 2021, being done in partnership with Baycare's Winterhaven Hospital, is meant to provide you, the community, an opportunity to learn more about our local physicians, as well as the programs and services that Winterhaven Hospital provides to keep our community healthy and thriving. On today's episode, we have the privilege of interviewing Dr. George Winny. Dr. Winny is board certified in psychiatry and child and adolescent psychiatry by the American Board of Psychiatry and Neurology. He also serves as the Associate Medical Director of Winterhaven Hospital's Center for Behavioral Health.
Well, thank you so much for joining me today, Dr. Winny.
Thank you for having me.
So I want to ask, we start off by learning a little bit about our physicians that are here in town. So tell us a little bit about where you grew up and what your journey to Winterhaven was.
I grew up in India. I was a doctor there, and I had my psychiatric training in India. I got my MD degree from the Center of WHO Research and Training of Southeast Asia, which is King George's Medical College. And I came here in America, and I had to go 5 more years of training and 3 more years at the Harlem Hospital Center at New York City, which is affiliated with the Columbia University School of Medicine. Then I did my fellowship at Bellevue, that is New York University Medical Center. And I was a faculty there. Then I moved to Chicago, and I was a medical director for child and adolescent psychiatry at Dreyer Clinic for 14 years. And I also was teaching at Loyola School of Medicine, the psychiatric residents. Then in 2004, I moved from Chicago to Polk County and started working at Winterhaven from 2005, March 14.
Well, and you finally made the right decision to move to Florida. So we congratulate you for that.
Thank you. I thought that I would have done earlier.
So tell us a little bit about your role at Winterhaven Hospital. As I mentioned in your introduction, you're board certified in psychiatry and child and adolescent psychiatry. So talk about how you work with Winterhaven Hospital.
So, I am working from 2005 onwards from Winterhaven. I am the associate medical director here, and also am a child and adolescent psychiatrist. So I am seeing patients on a daily basis. I have a lot of patients that I see, and I specifically see children and adolescents. But with the CBH, we have other doctors, other psychiatrists available to see adult patients. So we here see not only children, not only adolescent, not only adult, we also see geriatrics and all kind of help we do to the patient who come here, who needs the help.
And what kind of services does the Behavioral Health Center offer?
If I want to talk about Winterhaven Hospital, it's a private, non-profit general acute care hospital began in 1926, or 85 years ago. The CBH, the Department of Winterhaven, had a historical beginning in 1967 when it was created as the first community mental health center in the United States and developed with the federal funding aimed at that time to help the mentally challenged. So this is the history. So in 1967, we became one of the first community mental health center. Since merging with the Baycare Health System in October 2013, and in coordination with the Baycare Behavioral Health, our shared commitment is dedicated to the mission of improving the health of all who are served here by providing high quality compassionate care. CBH provides professional mental health services as an integral part of the system of care for children, adults in Polk County. We have been the primary mental health provider in Eastern Polk County for the Florida Department of Children and Families and the Florida Substance Abuse and Mental Health Program Office over 50 years. In addition, our traditional office-based counseling, psychiatric services expansion, diversification has resulted in the development of specialized school, community, home-based services for the adult. children and their families also. And we are helping the community-based psychiatric services for people who cannot pay. CBH employs over 80 staff consisting of administrative, clinical, and medical positions. Variety of fund sources are accepted, and no one is turned away for the lack of coverage. CBH serves approximately 9,000 patients per year and 70,000 services.
Wow, that's incredible number of patients that you see in a year. It kind of leads to a question of how common is mental illness?
Mental illness, what they say is very interesting. Some of the studies say that about 50% of the Americans will have mental disorder one time in their life. So in other words, more than 50% will be diagnosed with a mental disorder over time. But at this point in time, we look into the current studies say that about 20% of the patients are suffering from mental disorder. That means 1 out of 5. So, and according to certain studies, they say that it is increasing to 25%. So even if you look into pre-COVID era, the number of mental disorder is increasing.
Mm-hmm.
And then we have to add the alcohol and the substance abuse problem on the top of it. So what we are dealing with is that, comparing this mental disorder and the substance abuse, a lot of patients need to be helped. And that is what we do for the Polk County.
In your professional opinion, in terms of what you've seen over the course of the last year, do you feel like the pandemic has had an impact on the mental health of the community?
Yes, I can look into many viewpoints. The lot of isolation has happened because of the social distancing. The children are not going to school, so they are at home. And a lot of parents lost their job, and some family members died. So isolation, the trauma, lack of finance because of losing the job, and the fear of the future, fear of the anxiety, all these mixed factors, one, created new disorders like anxiety, fears, frustrations, and depression, and also made the existing disorder like depression, anxiety, psychosis, schizophrenia also got worse.
I was going to say, as a parent, and my kids are very young right now, but as a parent, the whole world kind of makes me nervous right now. And you specialize in children and adolescents as well. And of course, there's always pressures growing up as a child, and the whole learning about the social universe and how all of that works. But do you find that today's environment with social media and various different things that has an impact on children and adolescents differently than it would have when even I was a child?
Yes, it is, because they are influenced by what the peers think and also what the social media says. Now with the COVID especially, they're isolated. So one of the things I have seen, it is strange, is that I have less referrals for children during this COVID season because they are isolated from school. So the parents are worried about the things that is happening around them. They're not paying too much attention, but they are isolated. The common word I heard is that I am bored, I am bored, I am bored, and see a lot of anger and frustration, but I have not seen many referrals. But when the children go to school, that is where we get all these referrals. But on the other side, we have been exploding with the patient who is adult population with the anxiety, depression during the COVID season. But now, when the children started going to school, we are seeing the increased number of referrals for children. So it has very interesting kind of dynamics. For example, we have seen 400 new patients in last 1 month alone, new patient.
400?
400. And on an average day, around 250 to 260 patients come through this door on a daily basis. So we see them through telephonic, interview and follow-up, and Blue Jeans, that is an audio visual platform. And also we see some patient face to face. So a lot of frustrations there. The people react differently to the frustrations, and a lot of patients are affected, and the children are also affected. Yes.
So May is Mental Health Awareness Month, but after even just this short amount of listening to you, frankly, every day should be Mental Health Awareness. But what does that Awareness Month mean to you and your practice?
It is very important to us because usually in the past, I'm talking about pre-pandemic area and season, we will have a luncheon, about 200 people come. We have community speakers talking to them and sharing the story. And we also celebrate and respect the patients who have suffered and made more aware to people around what is going on. And also we celebrate during this time the team members who is working with the mentally health person. So it is coming. So because the pandemic season and the social distancing and CDC guidelines, we are working on what we have to do this next month for CBH.
What are the common signs and symptoms of mental illness, and when is it appropriate to seek care?
Okay, so you want me to focus more about children or more about adult or both?
Both.
Okay, so for example, let me say a few things about the children. One of the things we have to look for is depression, anxiety, anger, psychotic symptoms, attitude. For depression, it look like this for children. It come like a wave, and during this wave for a few days to a week, they feel like sad, mad, angry, irritable, feel like nobody likes me, leave me alone. What's the purpose of life? What's the meaning of life? So this is the kind of presentation you see. Then you need to have the evaluation. For anxiety, look like nervousness, worry, okay, feel like butterfly in the stomach, lump in the throat, difficulty in breathing, feel like puking, and muscle tense, mind going blank. That is how the anxiety look like. You can have ADHD symptoms like poor attention, poor concentration, distractibility, difficulty in sitting still, cannot finish the work you started, avoid, dislike, reluctant things that need sustained effort on the move as if driven by a motor. Attitude look like, which called oppositional defiant, losing temper, argues with the people, refuse to follow direction, annoying people, blame others for his mistakes, angry, resentful, spiteful, and vindictive. Then we can talk about depression in the adult. So they look like persistent, sad, anxious, and empty mood, ideas of hopelessness, worthlessness, crying, feel like what's the purpose of life, what's the meaning of life, life things, wish never to be born, wish to be dead. So bipolar means you have to have a depression and a manic symptoms. So you need to have a depression and a manic symptom, which mania look like this, talking louder, faster, thoughts racing, jumping from one subject to another, increased energy. So when you have this pattern mingle with the depression, we say you have bipolar disorder. When somebody is bipolar, they can have psychotic symptoms associated with it, some people. When somebody is clinically depressed, they can have some people associated with psychotic symptoms. So you can have psychotic symptoms separate. So psychotic symptom means you have features like not in touch with the reality, delusions and hallucination. Delusion is defined as a firm, fixed belief that that is firm and fixed, and that will not change with argument, logic, or reasoning. Okay, for example, somebody is following me. They want to harm me. I got to look back. No, there is nobody. No, I know that somebody is following. That's a delusion. Okay, or somebody is putting thoughts in my mind. No, there is nobody. No, I know it, and they are so convinced that is a delusion. Or my wife or my spouse is she is cheating on me, and there is no logic to it, no reasoning it, no evidence it, but he's convinced. That's a delusion. Okay, hallucination means you are having a perception without a stimuli. So we have hearing, we have a smell, taste, touch, and sight. So most common hallucinations are hearing things, hearing voices. The voices can be of different kinds of voices. For example, there is command hallucination means, and a voice is telling you, do this, kill yourself, attack people. That is command hallucination. Or third person hallucination means you can hear many voices talking about you. You are hearing that conversation. So there are different ways it can come and present. Seeing things means you see things which is not there. Or I see demons, I see devils, I see black shadows. I can see them. They are sitting here. That is a delusion. Sorry, that is an hallucination, visual hallucination. Then you can have this hallucination in the area of smell. The rubber, I can smell everything, rubber burning, the food, there is poison in the food. I can smell it or feel like somebody is touching me when nobody's around me. Okay, so you can have tactile hallucination. Okay, you can have olfactory hallucination. You can have auditory hallucination, and you have visual hallucination. Most common one you see in psychotic symptom is auditory hallucination and visual hallucinations. Okay, when you are looking into this disorder, one important thing you have to look into, do you have suicidal thoughts, suicidal ideation? Most common disease that cause suicidal ideations are depression, substance abuse, and other factors involved. Okay, for example, in depression, I may say 1 out of 20 people, when somebody is suffering from depression, can have suicidal thoughts. So we have to look into very carefully when you look into depression about suicidal thoughts, because suicidal thoughts are also increasing. For example, in Caucasian male, about the age of 18, it is increasing, and 15 to 24, it is increasing. Okay, these are the two, age group that is important. So we have to look into all these aspects when we have to have the evaluation. So then if you look into depression, we have different forms of depression. If you look into anxiety, we can divide into different forms of anxiety. We look into psychosis, whether it's a part of a mood disorder, there is a mood and the psychotic symptoms coexisting, or only psychotic symptoms, which is ultimate form, if it's existing, is called schizophrenia. So you can get all these kinds of problems. So when you see any symptoms of depression or psychotic symptoms and extreme anger affecting your social life, personal life, occupational life, or school life, then we have to get help.
Two-part question. If someone watching this feels like they personally need to seek help, how do they go about that? And then the second part of that question, if someone watching this feels like they have a friend or family member that needs assistance, how would they go about doing that?
They can walk in Monday to Thursday between 8 to 2 to register here at CBH. So I can repeat it, walk in Monday to Thursday between 8 to 2 to register. We take most insurances. We have financial assistance for those who qualify. The number I can give you is 863-294-7062.
As a general question, what are the most important activities or practices recommended for maintaining mental and emotional well-being?
To answer that question, I thought about it. I may say a few things that may help. Get some fresh air for a few minutes when you are frustrated, when you are tired, or in between. Go for a walk alone or with a friend, neighbor, or a family. That can help. Dance alone when everyone is away, or with your kids. Listen to the music of your choice. Watch funny videos. Okay. Take a nap when everyone is out of the home. Do a form of exercise that you enjoy. Take someone you enjoy to talk to. Take a break from your phone, computer, and social media.
That's probably the best advice of all. Turn it off. Turn off. After you're done watching this video, turn off the electronic device and enjoy a little bit of real life. Well, Dr. Winny, is there anything else that you want to make sure that the public knows about yourself or the Behavioral Health Center?
CBH is here and open for all those who are suffering in this area. We do a very good job. We have a lot of things we do. We do a lot of group therapy, ADHD group, dignity group, trauma focus group, and infant mental health, depression group, and anxiety group. Because of the COVID season, there are some of these things changed. And we have psychiatrists to do an evaluation, to have the diagnosis and determine what treatment is appropriate for you. And we have therapists available to give the counseling that is needed. And we have also case management to help you to come to home and help you with the situation. And we have also an indigent appropriate, if the patient has no insurance, they are the part of the county, we have an SCCT program. And so we have all kind of support system we do. Those patients who may have no insurance, they need the medication. We got some IDP program because it is being paid with the $5 it's a minimum co-payment. So we do all these things. The help is here. We are open. And we see about 250 people. You don't have to suffer. You don't have to be isolated. You don't have to go through this emotional pain alone. We are with you with an open heart and a loving spice. We'll welcome you.
Well, that's a wonderful way to end. And we certainly are so appreciative of the services that the Center for Behavioral Health has provided since 1967. I mean, such a staple in this community over the very many years. And so we want to thank you and your team for providing this incredibly important service to our community.
I also want to add one more. We have social workers who go into the school district and helping them at school also.
Mm-hmm. The partnerships that Winterhaven Hospital and Baycare have formed have truly been invaluable, especially as the amplification of the behavioral health conversation. I'm sure as you're watching that conversation grow and grow and grow, you're sitting back thinking, finally, because it's been such a center point in your life for decades. But the need for funding, the need for programs, the need for access to care is so important. And we've been blessed to have it through you all for many decades. So again, thank you, Dr. Winny, for your willingness to come on and spend your lunch break talking to me today.
Thank you for inviting me from the depth of my
Thank you.
Thank you.